tests show negative. Tonight, the fear of a possible Ebola case virus in California has come to an end.
We're happy to report that we've heard from the Center for Disease Control that the test result is negative.
Dr. Ron Chapman of the California Department of Public Health made the announcement just over an hour ago. The patient, who has not been identified, has been treated in Sacramento this week since showing symptoms of the Ebola virus after returning from West Africa. State health officials say the hospital followed state guidelines, which included isolating that patient after identifying the potential infection. During tonight's press conference, health officials said there are no patients described as high risk currently in the state.
Well, meanwhile, the 2 Americans who contracted the deadly Ebola virus in West Africa have been released from the hospital just 3 weeks after beginning treatment here in the U.S. Part of that treatment included a serum developed by a San Diego-based company. And as our Natasha Sweet reports, that serum is not yet being hailed as a cure.
Grinning ear to ear, Dr. Kent Brantley addressed a crowd of reporters Thursday, thankful to be breathing.
Today is a miraculous day. I'm thrilled to be alive.
Nancy Wright-Bull, a missionary who was also treated at Emory University Hospital for the Ebola virus, was released Tuesday asking for privacy. This week, both Dr. Brantley and Wright-Bull tested clear of the virus. Despite public concerns, doctors say once someone survives this far, there's no evidence they'll be a carrier of the virus.
The medical staff here at Emory is confident that the discharge from the hospital of both of these patients poses no public health threat.
While Dr. Brantley and Wright-Bull were both treated with the ZMapp serum created by the San Diego-based MAP biopharmaceutical, doctors still question if it's the sole reason for their recovery and aren't calling it a cure.
And frankly, we do not know whether it helped them, whether it made no difference, or even theoretically if it delayed their recovery.
We contacted MAP Biopharmaceutical, which declined to comment.
You treated me with expertise, yet with such tenderness and compassion.
Grateful for his treatment and the outpouring of support from the public, Dr. Brantley says he hopes his journey will bring awareness to the epidemic happening overseas.
Please do not stop praying for the people of Liberia and West Africa and for a quick end to this Ebola epidemic.
Doctors from Emory are now working to provide guidelines to their colleagues in West Africa to help diagnose Ebola patients despite their lack of resources. Natasha Sweet, San Diego 6 News.
Well, progress is being made. The death toll in West Africa continues to climb, now exceeding 1,300 from the recent outbreak.